Action plans to control and follow high-risk pregnancies have been compiled to support healthcare professionals. The plans contribute to our efforts to nurture healthy children and happy families. High-risk pregnancies are pregnancies with a higher risk of danger or even death to the mother, the fetus, or both. They also include cases with a high risk of complications before and after the pregnancy. Medical and social factors for high-risk pregnancies with regard to the mother who may have experienced complications in a previous pregnancy include high blood pressure, diabetes, impaired blood coagulation, preeclampsia, obesity, being underweight, endocrine disorders, and congenital anomalies of the uterus. Factors relating to the fetus include twin pregnancies, intrauterine growth retardation, and placenta previa. Existing health conditions can also complicate a pregnancy. Five action plans have been established to identify high-risk pregnancies and provide regular checkups. They are included in the reproductive health training provided by the Paraguay Continuous Education Project for nurses and midwives. The action plans call for nurses and midwives to conduct proper medical checkups so as to achieve zero mortality at birth for both mother and newborn. Let's take a look at each of the plans. Nurses and midwives in each district are expected to fill out a board on which they list their goals for their community. The name of the community to be taken in charge, the time target set to achieve results in the reproductive health domain should be shown on this board. A prenatal calendar makes it easy to see when the next checkup is due. Write each woman's name on a card and place it in the slot on the calendar for the next scheduled checkup. The calendar helps keep pregnant women from missing checkups and can lead to house calls. It also helps with high-risk pregnancies. The high-risk pregnancy file makes it easier to spot women with high risk factors and provide them with necessary care from the early stages of the pregnancy. To achieve zero mortality in mothers and newborns, an up-to-date record should be kept of the number of prenatal checkups the mother has had, the number of births experienced and the frequency of postpartum control, and the number of intended house calls. This makes it easier to get an idea of the risk of perinatal mortality and to be aware of the woman's needs in order to provide effective nursing care. The use of stickers on perinatal clinic sheets will help identify high-risk pregnancies and identify women with high-risk conditions or those who have experienced high-risk pregnancies in the past. By identifying both past and present high-risk pregnancies, it's possible to provide preventive care to women with a potential risk. The action plans are being put to practical use in various communities by health professionals who have undergone reproductive health training. Remove the checkup appointment card from the checkup calendar and take out the medical chart with a sticker indicating a high-risk pregnancy. This woman is 36 years old and has high blood pressure. She's now in her 35th week. After explaining the results of the checkup, advise her on proper nutrition, rest, and family planning.
decidí pues ya a un hospital Carapeguave ñañe la ginecólogo ni hay que tu jamás oye ya pondeme.
Sí, presión alta, eso no. Los sábados, domingos, mía, y lo añaden entonces que la base no llena no y la ni cuando tenga desde la domingo a la sábado mía.